So we are going to be introducing how to do a venipuncture on a cephalic vein. We'll be aspirating blood, injecting fluid, and then placing a catheter in the vein. So in order to do the cephalic vein venipuncture, we will be using the syringe, needles, and then I'll demonstrate a butterfly catheter. And for the IV catheter, we'll use a catheter and some tape. So in order to get blood from your cephalic vein, you're going to have a restrainer. Grab the leg on the medial side of the leg and twist the leg laterally. That will help the vein stand up. You will grab the patient's leg with your hand. Your thumb goes alongside the vein in order to stabilize it. Take your needle and syringe. You want to enter the vein with the bevel of the needle pointed up so that the sharpest point of the needle goes into the skin and vein first, and that's less painful. You enter the vein with your needle and you aspirate. Remember, you're holding your syringe at the base of your syringe, not near the top. Once you're done getting your sample, you take your thumb. Your restrainer can stop holding off. You take your thumb, you hold it over the hole, and you come out. So when it comes time to inject something into the vein, you'll again have your restrainer hold off, twist the leg laterally. To make that vein stand up, you grab your patient's leg. Again, you place your thumb alongside the vein. You will take your needle, bevel up, your solution's in the syringe. You enter the vein. You make sure you're in the vein. You aspirate back a little bit, get your blood. You ask your restrainer to please hold off or stop holding off the vein. You then slowly inject your medication, your drug. Once it's done, you hold off and you come out. Using the butterfly catheter comes in handy when you have an animal that doesn't really want to hold still. So the first thing you want to do with your butterfly catheter is take off the end. Set that aside. Now, you will then take your patient's leg, have your restrainer hold off. With the fingers that are holding the leg, you hold the end of your butterfly in a way that allows you to hold the leg still but still have access to the port. Take your butterfly wings and hold them together, and your needle is bevel up. You take off the protective sleeve there, you bevel up with your needle, put your thumb against the vein, you enter the vein. You can then let go at that point of the wings. If you need to readjust, these wings will open up and you can easily grab one in order to readjust. You then put your syringe on the port and aspirate. Once done, you can set your syringe down, hold off, and come out.